So hello guys, in this video I want to show you about the practical and clinical aspects which are being covered in video. So I advise you to pause, take in what is being shown in the app, and just so all of you must be knowing that in anatomy you have the basic things for practicals, which includes the osteology, histology, and you have embryology. These are being covered mainly in the lecture classes as well. And apart from that, you have the dissection hall videos, which are basically cadaveric demonstrations on how to identify all of these stuff. Okay. This is provided in the subject of anatomy, and for physiology you have the practicals, the hematology experiments, the amphibian and human experiments. Apart from, you also have clinical examination videos. The best part of clinical examination videos is that the basics are covered in physiology, and you can always go up to medicine to look at a more in-depth to get a more in-depth idea. And for biochemistry, if you see, you have the qualitative and quantitative experiments being shown on how to do those. You do those things in a laboratory. Okay. And even for pathology, so for pathology you'll be having the gross and microscopic as well. Okay. So these are the gross specimens. Okay. These are formalin specimens which are being explained by a teacher on how to identify those things. And apart from that, you also have the instruments. Okay, all these instruments, how to do the histology, the slide preparations. Okay, the various tests that are being done, as the ABO matching, tube methods, and you also have histopathology discussion and case-based discussions for your OSP. And if you look at microbiology, you will see that the major stuff, okay, culture exercises, special staining, and stool examination are being covered. I'll show you notes of which were made, so you have a better idea of what is there. In pharmacology also, you will have the spotters, the graphs, the pharmacovigilance, how to write a dosage form, how to write a prescription. All this stuff are being covered here. And if you look at forensic medicine, you mainly have these injuries. Okay, and the injuries, asphyxia, the postmortem changes, the X-ray images, and this part is the poison seeds, plants. Okay, these are shown with images, so you'll have a better idea. These are the non-clinical subjects. Oh, you also have PSM, I believe. In PSM, the various immunization schedules, the various vaccinations, the contraceptions that we use. Okay, all of these are kept for the spotters, and how to do the energy calculation. All of these are being covered in the classes, in the practical classes, and these are the major non-clinical stuff. So I'll just show you notes which were made previously by students, so you will have a better idea of what to expect. Okay, so these are the embryology stuff. Then these are the pharmacology, these experiments which are being shown. We also have the these are the amphibian experiments. Okay, so these are the hematology part. Okay, all of these are being covered. Okay, similar with biochemistry, and these are the microbiology slides. Okay, you see that there's a culture staining on how to do the differential diagram. These are the parasitology part. Okay, on how do you differentiate between the various organisms and all that stuff. Okay, tapeworms. Okay, and how to do this step. This is a stepwise process of the Zerin staining, everything. Okay, it is covered in such a manner. And these are the forensic medicine, the X-ray images, the dentition, the poisonous seeds. You have the poisonous animals. These are the post-mortem changes that we see here. Okay, such is the coverage that is being given, and this is the subject of ENT. So back to we'll start with the clinical subjects. So if you look at the clinical subjects, you will see that most of the content is being covered in the lectures itself. So you have the international examination, you have the investigations of the year. So if you look at the these are the tests which are being covered. These are more in-depth covered within the lecture classes itself. Okay, and you have the surgeries of all this stuff are being covered in the lectures itself. Similarly with ophthalmology also. So if you look at the PG videos, you will see there are clinics in ophthalmology. Okay, so these are the things that you actually do on a patient. Okay, this is being demonstrated on a patient. You see there are other okay, these are the rest of the lecture classes. One additional thing in ophthalmology specifically is that you have case scenarios. Okay, so in this the clinical questions, the essay questions, which are usually given in our question papers, that is being provided, and it shows us how to approach a case. Okay, the differential diagnosis which we use with each point. Okay, that is for the subject of ophthalmology, and you have the other clinical videos as well. Okay, in this you will see that there are case discussion on glaucoma, cataract, etc. Yeah, you have clinical case discussions as well. Okay, and in ENT also you will have the clinical videos. Okay, I will show you the notes of that, so you have a better idea. So these are the case presentations that are being demonstrated. Okay, this is the subject of ENT, and in this part you will see that the various tests are being performed, and it shows you how these tests are. These are notes prepared by a former student. Okay, so the osteology part, the instrumentation part, the radiological CT images, the HRCTs which are being used to describe all those things. Okay, and here starts ophthalmology. Okay, so start with all the various instrumentations that are being used in the practice, the various tests which are being used. Okay, these are okay. So all these charts, all these instrumentations, you will have a better idea once you visualize them. Okay, so that is the purpose of these classes. Okay. This is the community medicine notes. Okay, the various milk, the various contraceptions. Okay, the things are being used in immunization schedule. All of these are being covered here. Okay, starting with surgery. So if you look at surgery and medicine, these are the subjects which are, in my opinion, best covered subjects. Okay, so if you look at first of all, Tamil sir has printed classes, and if you look at the clinical subjects apart from physiology, okay, what you start off with is symptom analysis. Okay, you have symptom analysis, and you have the various tests which are being done on a patient. Okay, all of this cranial examination that are being done on a patient for us to understand how to do those things. Okay, and similarly you have this auscultation, the GI examination. All of these are being done on a patient, and this thereby it gives us an idea. And these are clinical case discussions. Okay, so they give us a case, and they teach you how does the patient approach it, and until the final management. Okay, such is the manner that it is being covered. Okay, I'll show you surgery as well before I proceed with the notes. In surgery, you have the clinical videos. Okay, these are Dr. Tiwari's like OT. Okay, how he does scrubbing, how he does the intubation, how he does the ET, how does he does the Ryle tube insertion. Okay, all of this is on a patient. Okay, and we have procedures we call the cholecystectomy laparoscopic as well. And these are patients which presented with this disease, and he's describing it as for us. Okay, and we have the clinical case discussions. I think the clinical case discussions are better seen in the clinical Wednesday part. Okay, so if you look at surgery, okay, these are swellings, breast lump. Okay, these are in-depth classes on all of these. You can how to provide. I'll show you notes of these. I have prepared those. So and even in medicine, we have separate clinical cases discussion. I am not specifically sure how to differentiate between the clinical medicine and the normal case-based discussion, but yeah, you have different stuff. With after surgery, look at obstetrics. Okay, obstetrics and gynecology. Okay, I'll show you the notes first, so you get a better idea. Okay, so I'll start off with medicine. Okay, this is the serious symptomatology classes. So what sir has done is he started with the basic symptomatology. Okay, and he's given the basic symptoms, and afterwards he describes the symptoms. Okay, the differential causes, how the common viva questions that the exam will try to screw you up with. Okay, those are stuff that is being discussed. Okay, this is the approach to anemia. I took photographs because there was lots to write. So yeah. So this is how he approaches the class. Okay, how do you present? Okay, and the negative history, like you give all those negative history, and why do you do that? Okay, so that's the modality of his classes. Okay, and even in this is the surgery classes. Okay, again takes too much time to write down the entire class, the entire history, so I took photographs. Okay, so this is the case presentations. Okay, so I took so he explains each of it, like every part that we do from SDAS or what do you revise, it's in why sudden. Okay, all of those things he explains, and that is the and you also have case presentations as well. Okay, these case presentations are there. I've seen videos of thyroid and breast as well. So there also we have the classes, and the thyroid especially I found it pretty useful because the classes were organized in a way that it started off with as sir himself describes, it started off with the physiology, the history taking, then the examination, and okay, it proceeds in such a way. Okay, so you will have an idea of what all is being covered. Okay, and till the management. I'm a fifth semester student, so I'm not too much keen on management, so I have not seen that part, but the rest of it, okay, the how we do those tests, okay, that is being demonstrated with video, so it's pretty useful. Okay, that's about surgery, and then we look at obstetrics and gynecology. Obstetrics and gynecology, okay, you have the clinical videos, okay. The clinical videos, you have the on how to do all of the instruments, the obstetric examination, how do you do symphysis of frontal height, how do you do the Leupold's maneuver, okay, do you see images, how does the gynecology history differ from the obstetric history. All of these parts are being shown, okay. And in the gynecology examination, you will see that there are other videos as well, okay. In gynecology, you will see that there is a video which describes on how to perform a gynecology exam, and this is shown on a mannequin and not on an actual patient, okay. Such are the videos, and similar to every subject, okay. In pediatrics, these are the introductions, which are the anthropometry piece, okay. And psychiatry is one subject which I found extremely good. First, this shows videos of a patient being a video of a patient, an actor shown who presents with these symptoms, okay. So we are able to appreciate what is being shown way more easily, okay. And not seen dermatology. You do have the basic skin lesions, okay, those are image based learnings. Yeah, that's about it, okay. And you also have the anesthesia clinics, okay. Yeah, I was in this part. Okay, these are the airway management systems, okay. Yeah. That is so this is about the clinical videos in E-Gurukul. So what I've done in this video is shown you what is being covered in the practical section and what is being covered in the clinical section. Hope you find it useful.